and Dr. Papika. I will go ahead and share my screen now, and we can go ahead and present. So, as Dr. Papika said, I'm doing a quality improvement project on contrast-induced nephropathy. Can you see my screen at the bottom? Apologies. Can you see? Okay. So I will be doing a research project on contrast-induced nephropathy and how we can better improve methods in the local region of the Inland Empire. So for background, what is contrast-induced nephropathy exactly? So contrast-induced nephropathy is a deterioration of kidney function due to the injection of contrast, which ultimately leads to kidney failure. So kidney failure is just marked by when the kidneys lose the ability to adequately filter waste. And so what exactly is this contrast? In our case, for our study, we are researching iodinated contrast media. And so this iodinated contrast media is going to be injected into patients to visualize the arteries and veins through a coronary angiogram, as seen on the right here. And so for patients with chronic kidney disease, diabetes, and hypertension, as well as several other parameters, contrast dyes can be too toxic and ultimately lead to kidney damage, and then can result to patients being put on dialysis and further problems. And so for general measure, creatinine is a waste product in the blood that is made when working your muscles, like every day. And so basically the kidneys filter out this creatinine from your blood and send it out through your urine. And what happens is that when your kidneys are diseased, these creatinine levels go up, causing a lot of problems. So one thing I want to really point out is that contrast-induced nephropathy is the third leading cause of hospital-acquired kidney failure today, and it's affecting around 12% of patients that have kidney failure. And so for the purpose of the study, there's two definitions that I want to explain so that it's not too confusing. So contrast-induced nephropathy is defined as acute kidney injury, or AKI, that is occurring within 48 hours of exposure to the iodinated contrast dye. And so PCAKI, or in other words, post-contrast acute kidney injury, is an increase in serum creatinine levels by greater than or equal to 0.3 milligrams per deciliter within 48 hours. So for the purpose of this study, we are essentially saying that they are the same thing and they can be used interchangeably, where PCAKI, or post-contrast kidney injury, is a more descriptive version of contrast-induced nephropathy. And so for the primary question of this study, we are trying to determine whether high-risk post-contrast acute kidney injury patients would be less likely to develop a sustained creatinine level of greater than or equal to 0.3 milligrams per deciliter within that 48 to 72 hour range post-procedure if given our hydration protocol, which I will get at in a second. So for our methodology, this research study was an observational study conducted using de-identified patients from St. Bernardine's Hospital. And so prior to getting to work on this research, it was approved by the IRB for not human subject research. So in total, there were 25 patients that participated in the study, which all received what we considered to be our hydration protocol for our procedure. And so all of these patients were labeled as high-risk patients, which in which they all had a past history with one of the following symptoms: acute coronary syndrome, chronic kidney disease, and more. as listed below. And so what exactly is our hydration protocol? Well, it is a four-step method that we used, um, the doctors used when performing the surgery. So during the pre-catheterization phase or pre-procedure phase, 500 total cc's or milliliters of normal saline was introduced to was intravenously given to each patient, and it would span over a range of like 1 to 5 hours, depending on how much fluid the patient could take, based on like their heart and how strong and healthy they were. And so during the procedure, which is the catheterization phase, a coronary angiogram would be injected through a contrast dye would be injected through the catheter at varying volumes to better visualize the veins and arteries and how they're doing. And then during the post-catheterization phase, another 500 total milliliters of saline was given. So in order to obtain the results that we have, we had to conduct the patients had to conduct blood tests during a 48 to 72-hour period post-catheterization, because that's the time period where they're most likely to get this contrast-induced nephropathy. However, only 9 of the patients completed their labs, so our data is only based on those 9 patients, which is unfortunate. And so for our measures, we mainly measured serum creatinine levels, which, as I explained earlier, helps define like how well the kidneys are able to filtrate stuff through your blood. And so the normal levels range from 0.6 to 1.2 in males and 0.5 to 1.1 in males. So before even conducting the experiment, we basically predicted that if normal saline is a fluid that is preventative of CIN, then we expect to see lower creatinine levels in these patients, right? After the procedure. And so what we see here is a comparison. It's a comparison of creatinine levels in the 9 patients that obtained their lab tests pre and post procedure. And so day 0 marks the pre-procedure levels of these creatinine levels. And so days 1, 2, and 3 each mark the 24, 48, and 72-hour period post-procedure after the contrast dye was admitted to each patient. And so what we see here is 8 out of the 9 patients that were given contrast dye had a difference between their pre and post levels, where the creatinine levels either had a small rise or actually reduced within the 48-hour period, which is what we were expecting. And so however, there was one patient, which is indicated by the red line on the graph, that received post-contrast acute kidney injury, which we mark as greater than or equal to 0.3 milligrams per deciliter. And so in order to assess the significance of this graph, we performed a two-sample t-test, where we saw that our p-values were below point. Some of them were. All of them were below the alpha value of 0.05, as indicated below, meaning that the graph is significant and that our results came out as expected. So, as I said earlier, in 8 out of the 9 patients, there was a trend that was favorable, and what the t-test showed was that the actual creatinine levels in patients were lower than the expected level, which was around 1 milligram per deciliter, 72 hours after the procedure. So what does this mean to all of you? Basically, what it means is that there is a good chance that this procedure um, decreases future risk of post-contrast acute kidney injury in patients that receive this additional saline volume. And so obviously future observational studies are needed to better understand it. So as I said earlier, it was unfortunate that we had such a small sample size because of just the fact that several patients didn't receive or didn't do their lab tests. And another limitation was that not all the patients had the high risk markers. Like some had chronic kidney disease, whereas some had acute coronary syndrome, and each of those play a different role in affecting contrast. And so what that can do is cause confounding variables in how much the saline plays a sole role on the patients. And so for future directions, we see that uh, a bigger patient sample size will obviously provide more statistical power for this study. And we would like to see more patient trends that are typically decreasing in that 48 to 72 hour period. And another option is long-term follow-up studies. So in the literature currently, a lot of studies regarding contrast-induced nephropathy only measure this 72-hour period after the surgery. But what that leads to is an underestimation of nephropathy risk because it can actually be caused it can actually be induced in patients after that period. And so that can be misleading, and some patients can contract the condition. So I want to acknowledge to my faculty mentor because I'm doing this for my honors capstone. I want to thank him very much for all the personal and professional growth that he has given me. This truly was a collaborative effort, and I am extremely thankful for all the guidance that you've helped me with throughout this project. And I also want to thank UCR Honors, our university honors, for giving me the resources to go to be prepared for when I graduate. And here are my references. I will stop sharing. And